When we talk about psychological disorder, we also have to take note of these scientific study of psychological disorders known as psychopathology. And the study of these psychological disorders are not just limited to psychologists, but instead, we will be working with a lot of professionals, which would include, but is not limited to, counseling psychologists, medical professionals, psychiatrists, neurologists, and other psychiatric professions that are involved in the study or the scientific study of the different psychological disorders. Okay? It actually grew from a set of practices that we've already encountered, maybe from the past 100 years. And that's what we'll be discussing for this video. Ano nga ba yung mga historical components ng abnormal behavior and how these abnormal behavior are seen by the people during the medieval times, or during the pre-industrial times, and now that we have these scientific approaches. But, of course, it is just here for us to reminisce how important it is for us to understand these historical components. Nevertheless, I want to reiterate as early as now that we have to adopt a scientist practitioner approach whenever we deal with psychopathology, so that we can keep up with the latest scientific developments, have our ability to evaluate our own way of assessment, diagnosis, or treatment, and of course, conduct research so that we can contribute to the ever-growing body of data that we have to understand abnormal behaviors. All right? Sige, let's proceed. So, when we talk about the historical components, it's actually started with the supernatural tradition. Deviant behaviors were considered to be a battle between good and evil. Most of them believe that an abnormal behavior or a deviant behavior, which is something that they used during those times, are either influenced by witchcraft or demons. Some of them also use magic, sorcery as an explanation for these deviant behaviors. Some of them are being treated through exorcism and other medieval ways on how they can take care of those deviant behaviors. Sometimes they ask people to go to mass, they ask people to confess their sins, they ask people to pray to other goddesses or even to other non-living things such as the moon, the trees, or others. Alright? Kaya siguro familiar kayo or baka narinig nyo na yung terms na lunatic, tarantism, St. Vitus dance. Those are previous terms that people used to name a deviant behavior, especially during the medieval times. Diba? So, for those people who tend to behave erratically or deviantly, when the moon is full, they term or they call them as lunatics. Alright? So, there are also people who were believed to be bitten by a tarantula, wherein after being beaten, they would usually dance non-stop or do some erratic set of behaviors without actually stopping up until they reach a point of exhaustion and even death. And that's what they call as tarantism. Marami pa, Maraming iba't ibang terms na ginagamit from one location to another, but those are just some of the terms that you might encounter on some references, especially discussing about the history of abnormal psychology. Talk about the biological tradition. Actually, different references refer to this biological tradition as a transition between the medieval set of procedures and then the biological tradition, and then there came religion, where they actually moved back to the supernatural tradition of looking into the different deviant behaviors, but eventually they again adopted the biological tradition, which serves as a precursor towards the development of a better understanding about abnormal behavior. So, based on the available material that I have, it's actually Hippocrates who first suggested that these psychological disorders can be treated just like any biological or medical problems. So, he believed that it is caused of brain pathology, head trauma, or heredity. Then, there's also a Roman physician named Galen who proposed that it could be due to this what they call as chemical imbalance between four bodily fluids or humors. You may have already heard about it when you discussed it in theories of personality. No, yung melancholia, sanguine, okay, phlegmatic, etc. Okay, so that is known as the Hippocratic Galenic approach. So with that, they propose a treatment that balancing these humors in our body could also prevent or treat a specific abnormal or deviant behavior. Other physicians actually suggested that bloodletting could also be considered as a way of treatment. Again, we can blame them for suggesting or experimenting on this kind of approaches because during those times, wala pa naman ding napapatunayan na effective treatment for these deviant behaviors. Hindi pa nga nila gaanong naiintindihan, no, kung ano nga ba ang pinagmulan or saan nanggagaling itong deviant or abnormal behaviors na ito. Then, there's another physician known as Robert Borton who introduced the way how they can treat mental disorders through vomiting. So, induced vomiting, actually, pipilitin kang magsuka. There's also another way of treating mental health disorders from the past that suggested that marriage or fumigation of the vagina is actually needed to treat hysteria. No, hysteria is actually coined by Hippocrates, initially known as the wandering of the uterus, all right, that causes erratic behaviors specifically among females. Later on, Sigmund Freud and other psychiatrists also suggested that it is indeed existing in males as well. Okay. After that, there's also an attempt to treat a specific mental health problem by inducing malaria, no, para yung init ng katawan, yung lagnat, yun daw yung magtitreat dun sa mental health related problem. Okay? And then there's John P. Gray, an American psychiatrist that explained that all psychological disorders should also be treated as something as a physical disorder. Okay? Meron ding nag-introduce ng insulin shock therapy. So basically, they will be inducing convulsions so that they can treat these mental health problems, even to the point of comatosing the patient. No? Yun ay ang nag-introduce nun ay isang Viennese physician known as Manfred Seikel. Alright? Then, you may have heard about the electric shock therapy, no? Or brain stimulation therapy using electricity. It is actually accidentally discovered by Benjamin Franklin when he accidentally electrocuted one of his friends, and then it was adopted by Hugo Cerletti and Lucio Bini as a possible way of treatment, especially for depression. Actually, even up until now, there are a lot of treatment that looks like electric shock therapy. Pero syempre, mas humane na yung treatment or yung procedure na ginagawa natin. Okay? So, there are also certain physicians who used opium, no, as a way of treating neuro or cognitive problems or other mental health problems up until Emil Kraepelin, considered as the father of modern psychiatry, helped to understand better these different diagnoses. That's why he developed the initial classifications of diagnosis of abnormal behavior. So, according to Emil Kraepelin, there are two primary groups of mental disorders that they can understand at that time. That's manic depressive psychosis and dementia praecox, which is now known as schizophrenia. Alright? Unfortunately, the psychiatric approach was also opposed by Thomas Saz. He initiated the anti-psychiatry movement. And he wrote a book about the myth of mental illness, focusing on the possible abuse of authority coming from the practice of psychiatry, where also the different set of adjustments, ethical code of ethics were based, that much of the practices now that falls under psychiatry, of course, focuses on how the patient will benefit. Then we have the psychological tradition. Actually, it was believed to be proposed as early as Plato's time. No, but it is actually Philip Pinel who pushed through such movement and introduced the first workable psychiatric nosography. This is actually a set again of another classifications in order to understand better what and how to treat these abnormal behaviors. He gave 4 major classifications, which would include melancholia, dementium, idiotism, and mania. Melancholia is basically divided into with delirium or without delirium. Aside from Filipinel, some of the contributors for the psychological movement includes Jean-Baptiste Poussin, William Tuck, and Benjamin Rush. Okay? So this is also the time when moral therapy was proposed to treat institutionalized patients. So basically, it gives them an opportunity to seek humane treatment so that they can be responsibly care or provide a responsible care for those patients. It is actually headed by Dorothea Dix, which initiated the mental hygiene movement. So much of these things, the moral therapy works best according to research for institutions with 200 or more patients. This also gave an opportunity for other approaches in understanding abnormal behavior so that we can further explore and that's how we reach this point of understanding them better. All right? So based from that, historical components of abnormal behavior, we know that there are certain approaches that uses a one-dimensional approach, and now we have this multi-dimensional approach. When we say one-dimensional, it would be either you will go with traditional, biological, psychological, behavioral, emotional, social, and even developmental. All right? So as long as you would be using those dimensions as a single way of interpreting, understanding, and abnormal behavior, that would fall under a one-dimensional approach. All right? But we now know that that's not the best way to understand an abnormal behavior. But instead, by using the contributions of different schools of thought so that we can understand them better through a multi-dimensional approach. It means that those things that I've just mentioned earlier would be contributing to the development, monitoring, and treatment of these abnormal behaviors or psychological disorders. Alright? So I hope I was able to give you an overview about abnormal psychology, psychopathology, the historical components, and the different dimensions or models that we use to understand abnormal behavior or psychological disorders nowadays. Okay? So on our next video, let's talk about something else. Thank you so much for listening. Again, this is Lordy, ang tito mong psychologist.